Good evening, everybody. This is Dr. Kumaresh, Senior Consultant, Dr. Kumaresh ENT Clinic. This is going to be a series of patient education videos wherein I'm going to give you information regarding the common conditions, what to do when, let's say your child is crying at night and in the middle of the night he wakes up, touches the ear, one side of the ear, and says it's paining. What are you going to do? So already I have written about this in detail in my blog, which you can visit in the site given below. And it is drkumaresh.com/blog where you will find all this information. But since a lot of patients have been requesting me to send it in the form of a video blog or, so that's why I'm creating this. Now, as I said, it's going to be serious. The first one which I'm going to start is going to be the most common thing, which is known as acute otitis media. What do you mean by acute otitis media? Acute means which is happening within a short period of time, let's say in a few days. Otitis means it's an inflammation of your ears and especially the middle ear. Sudden is generally, I'm not going to say this is a norm, it's a generally because of some inflammation. So when that happens, don't get panicky. Use a pediatric nasal drop and use two drops to both the nostrils. Instead of one drop, you're going to use both the, two drops in both the nostrils. Now, how does the nasal drop help? As I told you, majority of the time it's because of inflammation in the middle ear. The middle ear is connected to the back of the nose in an area known as the nasopharynx. So what happens if there is going to be cold, there is going to be swelling, irritation, inflammation, and the same thing which affects the nose is also going to affect the area surrounding the nose. And one of the areas which is very close is the nasopharynx, which is a pathway which connects the back of the nose to the throat. So once the tube gets inflamed, what happens? The tube gets blocked. When the tube gets blocked, there is a blockage, a negative pressure in the middle ear, leading to fluid accumulation. And this is the reason why the child suddenly, catches the ear and cries with pain. I'm sure those who are frequent flyers would experience sometimes the flight is taking a descent. You'll have a acute pain wherein you clutch your area and don't know what to do. People start swallowing. People start doing all sorts of tamasha, only causing more harm than good. Even for those who are traveling by flight, if you have it, just keep on swallowing. Once you keep on swallowing, the middle ear should get equalized and the pain should subside. But in a child, it doesn't know what to do. So just apply the drops. Give them some pain syrup, painkiller syrup like a paracetamol. I don't give anything beyond paracetamol for my patients. I don't even give them ibuprofen because I think it's too strong. Leave alone for a child, even for an adult. And once you do that, take the child to a specialist, and the specialist examine and they will give appropriate treatment. Majority of the time, it settles within a day or two, and sometimes, the eardrum will rupture because of the pressure. Because the pressure in the middle ear is the space in the middle ear is very small, and anything which is going to occupy the space is going to cause the drum to be bulging. The drum is bulging and it's very red. I mean, beyond certain time, the drum will rupture and you will start having a hole and some pus coming out of the ears. Now, even if that happens, don't get panic. Oh, what to do? Nothing. Is it going to be lifelong? Nothing. In children, they are extremely resilient, and majority of the time it heals within about 2 weeks, where the drum becomes normal. Only in cases where it's very frequent, and I say frequent once in a month or once in 2 months, I always tell my parents to check for a tissue known as adenoids, which are easily diagnosed by X-ray. Now, that is a topic for another session. So, any child who is going to clutch the ear in the middle of the night, the most common cause, I'm not saying that's the only cause, the most common cause is because of inflammation. Try putting a drop or give them some painkiller. If doesn't work, then you can always take them to a nearby hospital or to a specialist. I hope this helps. Please keep on watching and I'll be giving more information in the videos to come.